Hello and welcome to the training on post-COVID-19 critical services only. My name is Tammy Bennett and I'll be guiding you through the recommendations for the first patients to be seen in the in-person clinic after COVID-19. So the recommendations are to go ahead and open for in-person visits where the RN will be seeing lab-only visits that will be done to draw the needed labs from the telemedicine visits that the APRN had recommended. The second criteria of patients would be as those labs come in and are positive, if they have not been already treated syndromically, to get them in for a treatment-only visit. And then the third type of patient that we'd like to see in person would be, of course, any patient with symptoms of syphilis or a contact to syphilis, so that we can go ahead and give them their bicillin and draw their blood. APRNs at this time, it's recommended to go ahead and continue telemedicine visits for those who are needing annuals, who are 39 years and younger, who are on some type of birth control. Of course, we will do the whole annual if we find out that there's no PAP due and no complaints. However, we can go ahead and just meet the birth control needs if those patients need a refill on their birth control but do have issues. We can go ahead and meet those needs via telemedicine. The other type of visit is we're going to go ahead and do a wait list for those in-person visits that need procedures. We're going to offer a bridge method through telemedicine until we can open up for those in-person visits. And also, the APRN will continue with STI symptomatic. She'll get the history, and then she can schedule the lab-only appointment to have the labs drawn with the nurse at a local health unit. As discussed, we're going to be talking a little more about a wait list function within the EHR that will be demonstrated later. But those who are going to go on the wait list for in-person visits include those annuals who are 40 years and older, who who have already had all their birth control needs met either by a tubal or vasectomy. We're going to go ahead and put them on a wait list. Any annual that is 39 years or older that decline, or 39 years and younger that declined telemedicine, as well as annuals who are on birth control who need a physical exam, procedures for insertion or removal, and then this asymptomatic STIs we're going to put on a wait list. So as discussed before, whenever the nurse practitioners were seeing telemedicine for these last few months, it was recommended based on their sexual history that they get labs done to make sure that they don't have anything that was asymptomatic, that were not causing them issues. There is a list, an Excel spreadsheet of everything that we've pulled from EHR, and that contains 5,842 patients who need to be called and offered in-person appointments at their local public health unit to have their labs drawn. And we are going to be sending this out so that your staff can look at this and go ahead and start calling to make appointments. So the way that you'll do this is we'll get the list of all the patients who were recommended to have labs, call the patient, offer them a lab-only visit at their local PHU. When you schedule the appointment, you're going to look for the reproductive health lab-only visit code under the nurse template. It looks like RH Lab under the nurse template. And you'll schedule the appointment with the newly created visit type. It might be easier if, I'm not sure how you want to do this, but if one health unit is booking all the appointments for all of the region, then you may want to have a resource group where all of the nurses who are doing the lab draws are on one view, and you can ask the patient what PHU is closest to them and where they would like to go, and then you would be able to, at a glance, go ahead and make that appointment. But it's up to you, just letting you know that that option is available. Another thing is if the nurse who is going to be doing the lab draws for that day has another template active, such as assisting provider or RH nurse, then you will need to ask your regional leadership team to drop in the nurse template for that date. Regional leadership should know how to do this, but just to remind, you go to the Entergy base, go to scheduling, and then go down to rotation assign, pull up the specific provider, go to specific dates, and on the date that you wish to drop in that nurse template, you'll hit assign and do your nurse at that location. That will open up that nurse so that she can do nurse visits for that day. After we start drawing labs and we find that there is going to be some positives that come in that have not already been syndromically treated, we're going to call them and have them come in for treatment, just the same as we did before. A couple of caveats to that: we're going to use the same treatment visit code as before. For the location code, make sure that you are using the location specific to your in-person visits and not your telehealth visits. Telehealth visits will have a T in front of that location code. So make sure if you're doing an in-person lab, it does not have a T in front of it. So let's say that the nurse or nurse practitioner identifies a patient with symptoms that's consistent of possible syphilis. That nurse practitioner will go ahead and make an in-person appointment for that patient to come in, to be seen, and to be given bicillin. The other thing is with the contacts, we'll need to also get the contacts in for their labs and their bicillin delivery and treatment as well. We would do that as a RH nurse problem visit, just as before. We talked a little bit about the wait list, and there's you can get to the wait list either by base Entergy or through EHR, and I'm going to show you both ways to do it depending on which program you use most often. In base Entergy, you're going to go into base Entergy and then go up to scheduling, hit wait list, and then do new, and then select a patient. Select the reason, the provider, you can add any notes. You're going to look, and if it's an urgent patient, which the nurse or the nurse practitioner will let you know if they're urgent, you're going to check that box. If not, just leave it blank. You can also select the preferred days and times and then click Save. Let's go through, and we're going to do a demo on this so you can see it. If you have a patient that calls in and needs to be put on the wait list for an in-person visit, these are the steps that you will go through. The first is to open the base Entergy, go to scheduling, wait list, hit new for a new patient to go on the wait list, and you can toggle by the name, date of birth. I'm going to do the last name, double click it. This is saying what is the reason that the patient needs to come in for the in-person visit. You can go to class, you can click RHN for reproductive health nurse, you can do RHM for reproductive health medical if you need a nurse practitioner in-person appointment. I'm going to go ahead and select the reproductive health medical, stating that she needs to come in for a procedure to have her IUD replaced. Hit OK. This one is important. Make sure you key in which provider they will be coming in to see. So this is going to be either your nurse or your nurse practitioner. If you don't know the specific nurse practitioner, you can go ahead and put location. Like if you have, they need to come in to a specific location, you can put that there. If you have any notes, put the notes here. Urgent is very important, so the nurse or the nurse practitioner can let you know if the patient is urgent to get, like the very first ones that that in-person appointments that come open. If it's urgent, that would mean like the IUD is expired, we need to get it replaced, they don't have anything for birth control, we need to get them in as soon as possible, you know, that kind of thing. I'm going to click urgent. If the patient states they can only come on a certain day, then you can click here. If they say they can only come in the morning or the afternoon, you can click here and then hit save. This puts them on the wait list. Because we marked urgent, it's going to be in red, making it very obvious that they are ones that need to get in as soon as possible. Now let's say we've opened up the template for in-person appointments and it's time for you to start scheduling from this wait list. What you will do is you will open the appointment scheduler. You will go to the specific nurse practitioner, which I'm going to go to myself so I don't mess anybody up. Click on the appointment time that they have open for the desired time. Click appointment and view wait list. You can uncheck all of these boxes and just leave provider, or if you're doing it by location, you can click location and unclick provider and it will show you which ones are available. Once you find the patient that you want to schedule, highlight it and hit accept. It automatically brings in the type of appointment that you said that they needed. Make sure that the location code is the in-person code. So it would be whatever code it is minus the T. T is only for telemedicine visits. The just number for the location is where that in-person visit will be. And once you click the location, hit save. It's going to give you a warning that the service center has been modified. Go ahead and hit yes because you've moved it from a telemedicine to an in-person visit. And now you can see that that has a 35 there instead of a T35. And that's because it's an in-person, not telemedicine. So it's been, that appointment has been made, then it's not there. It's already been made, so it's already on the books. Let's talk about how to do the same process, but just in the other side in Entergy EHR. So what we're going to do is we're going to, whenever you identify a patient that maybe you're seeing today or maybe that no-showed and they need to go on the wait list, you're going to open EHR, open the appointment scheduler, select the patient, click existing appointments, and make sure you check include history. Then select the go to button, which will take you to that appointment. At that point, whenever you're on the appointment screen, you can click new and new wait list entry. The second part of that is the same. So let's review the demo for this process. So if you're into the Entergy EHR, you can also add a patient to the wait list from this side as well. Let's say that you're seeing a patient for a telemedicine appointment and they need to be put on the wait list for an in-person exam, be it that they need a pap smear, they need a bimanual exam, they need something that you cannot do via telemedicine. Perhaps it's a LARC insertion or removal. So the way you do that is you would go to the appointment scheduler. You can either click this button here, or you can go up and hit appointment scheduler here. you're going to bring up just your schedule. And if they're on your schedule already today, that makes it easy. You'll right-click and you'll hit Make Selected Patient. As you can see right now, no patient is selected, but as soon as you right-click on your schedule, hit that patient and make it the selected patient, anything you do now is going to be under Haley Do Not Use or whatever patient's name it is. So at that point, you'll go up to Appointment and you will hit New Waitlist Entry. And you will follow the same steps as before. The only difference, if you go through this way, you're still going to have to change what type of procedure, what type of appointment they need in person, but it already has your name and your location selected. Just verify that those are correct, and then, of course, if it's urgent, mark urgent, and then you would hit Save. Now, let's say that they're not on your schedule. The only thing you do is go up to Patient, hit Select, and at that point you'll just pull up your patient just in case they're not on your schedule for that day. You'll pull up the patient that way and it will be here identifying which patient you're working with, and you'll still go to New Waitlist Entry. So it just depends on if they're already on your schedule. Here, let me show you, like if we were to reschedule a test patient from the 5th, let's say this patient did not show and it needs to go on the wait list now. See, we were in Haley's, but now we need to switch to this other patient. So we're now going to make this one the selected patient and put them on the wait list. So as you can see, that's the way you would do that. You would change the class for reproductive health medical if they're a nurse practitioner visit, reproductive health nurse if they're a nurse visit, or if they just need a blood draw, it would be nurse, NSE, for blood draw. Now, it'll be rare that you will put a blood draw on the wait list, but if that's your workflow, then you can certainly do that. The next part is just showing you that you can view and print the wait list if you need it. So the way you do that is you would go into Base Entergy, go up to Scheduling, click Waitlist, and then Reports, and then Waitlist. And you can sort by either your time it was entered, your reason code, your class, do it by provider, and then if you only want to see one provider, click here. And then if you only want to see certain days of the week, or if you only want to see the urgents, you can do that. Again, the easiest way to schedule from the wait list is doing so by the workflow previously shown, where you're actually in the scheduler, you view the wait list, and you go that direction. But if you ever want to have a list, there is a way that you can print that off. This is what the report will look like once you run it. It'll tell you the provider's name, what patient it is, what the procedure is, and what desired time and day that they wish to come in. Clerk, on the day of the appointment, they make sure to update the demographics when the patient comes in, perform the household assessment, verify the insurance, check the eligibility, and if the eligibility comes back with any errors, they go ahead and correct that. Make sure you update the privacy screen for the consents that were obtained that day. Have them complete and sign the LDH consent for services and billing. And then on the flow tracker, you check in the patient. The clinical documentation for a lab only, we've tried to make as easy as possible. So the nurse will open up a billable encounter after the patient's checked in using the follow-up note, lab only. And then there's a box that says labs done based on whatever day visit with the MP. Then she'll go to the orders charges cart. There is no 99211 E&M code that will be used on these lab onlys. We can use the venipuncture code as long as you don't use a 99211. And we will not be using any 99211s with these lab onlys. After that, you'll order your lab test and then draw and process your labs. Here's a demo of how that works. So here we are at the Entergy EHR side of things, and we're going to show you the nursing workflow for lab-only visits. Once the patient has been checked in, it will be purple in this box. You can go ahead and call the patient back to the back, click their name. We have a new template that you're going to be using under Note. So go to Note, you can go to Forms, Shared, and it's going to be right here, Lab Only Visit, and click OK. Here it's self-explanatory. Of course, if you use the language line, please make sure you click that. And you can go ahead and click the Lab Only Visit. If you do notice during that lab only visit that they have a new complaint or need to be seen by a nurse or a nurse practitioner, you will need to click this right here where it referred to RH needs appointment. Again, a lab only visit is just that, only to draw labs. If you have the availability to see that patient that same day, then that's fine. However, it would not be a lab-only visit. It would need to be changed up at the front to reflect the type of appointment that is needed. All right, and then after that, you're going to go down and you're going to review the documentation on past encounters that state the nurse practitioner recommended X, Y, and Z lab test to be done. You're going to note that date that the patient was seen via telehealth. Go ahead and key that in. And check the labs that you've done today. The draft will show that you've got the test ordered, your documentation of recommended lab studies were performed today in accordance with the APRN recommendations from the telemedicine visit on that date. And I'll fix that typo. At that point, that's all the documentation you need. You're going to go to Orders Charges. At the very bottom of your favorites, you're going to have lab only RH codes. If y'all will remember correctly, we took away the option to bill for venipuncture. You cannot bill venipuncture when you're also billing any other type of E&M code. However, in this instance, we're not going to be billing the 99211 for the lab-only visit. So in place of the nursing E&M code that you would see way up here for the nurses, you're going to be selecting either the 36415-FP if it's a female and 36415-STD if it's a male. So let's say this is a female. We're going to select this one. Let me go ahead and search for my diagnosis. Select your code and then select your high-risk heterosexual venipuncture to go with it. Then you're going to go over to labs and you're going to select the labs. Remember to save between each of your lab orders. If you do not, then if something gets rejected from the lab, you're going to have to void the entire requisition and reorder. There's your syphilis test. Save. There's your INSTI. You can go ahead and result it, which was also going to drop, and you can go ahead and close that order because you're resulting it and dropping the charges. And there's the charges for that. You can also order, you know, if the recommendations were to do a hepatitis C test or any of the others that you need to do. So E&M code is not the 99212. It is going to be this venipuncture code followed by all of your lab orders. Go ahead and result anything done in the office and close that order. Hit save and you're done. You can task out that appointment that's needed to your clerk, or however your workflow does it in your clinic. So the next thing is just going over the clerical checkout. Once the documentation is complete on the EHR side, then the front clerical side will check out the patient. We'll post those lab charges to the Open Today's Journal using the regional medical director in your region as ailment MD. Because these are lab only visits and going to be done by the RNs, the ailment needs to be the regional medical director. Please let us know if you have any questions about this training below, or my email along with Tisha Reed, and we hope that you have a great reopening.